I'm going to go ahead and record, and thank you guys all so much for being here today. And we'll go ahead and start off with names.
I'm Amy Gavella.
I'm Erin.
I'm Anik Shea.
Oh, you're muted.
Oh, sorry, I'm Janez Mulder.
Perfect. And again, like I just said, thank you guys so much for being here. My name is Christina Zell, and we're here also for presentation number 3, which is going to be about the coronavirus. So as we're getting into the late stage of 2020, a lot of us feel like we're getting comfortable with how we're handling the pandemic. But at the same time, because bars are also open at full capacity in Florida, I do think we are due for kind of a refresher course. So in the next few moments, I'll go ahead and discuss what we can do to combat SARS-CoV-2, also known as COVID-19, or generally as the coronavirus. And I know this is going to be important to everyone since we're all being impacted by this global pandemic, and we do want to return to some sort of normalcy in the near future. And in order to do that, I'm actually going to propose that everyone be tested for COVID-19 every 1 to 2 weeks. And yes, everyone, regardless whether they are experiencing symptoms or not. And so today I will be talking about why we should do this to help with the coronavirus pandemic. So people should definitely test for COVID-19 every 1 to 2 weeks to know your current infection status rather than just assuming negativity. And Los Angeles has actually made testing really accessible to everyone, regardless of immigration status or insurance type. Coronavirus symptoms can take anywhere between 5 to 2 weeks to incubate after infection, and frequent testing allows us to confirm infection status and really properly isolate those who do have coronavirus. And it allows us to look at that infection before and after the presence of symptoms. And according to Is Your State Doing Enough Coronavirus Testing, which was last updated on October 17, 2020 by Keith Collins at the New York Times, not enough people in California are being tested. And this determination is based off the methodology developed by Harvard Global Health Institute, which promotes daily testing for people who are experiencing flu-like symptoms and at least 10 other people. And they are requesting 10 other people to make sure that there isn't more widespread community, that the coronavirus isn't more widespread in communities other than what people are experiencing. So again, testing in Los Angeles is free, and with the Community Organized Relief Effort, CORE, Los Angeles oral swabs have a 24-hour turnaround. So it's pain-free. It's not that like nasal swab that's going to stick you in the brain. It's just an oral swab, really quick turnaround time. Is offered no cost again, regardless of your insurance status. And if you live in Culver City, the closest testing location is actually at the VA hospital. An appointment is required, but you can usually find one same day or next day, and you do not need like a physician referral as well. And so high testing rates allow us to get a better understanding of spread within the community, and again, allows us to isolate those individuals from the general healthy population. And ensuring negativity actually allows us to have the existence of quarantine bubbles, which allows us to see our friends and family. And according to the June 17, 2020 article, The Rules of the NBA's Disney Bubble by Ben Cohen at the Wall Street Journal, the NBA bubble was able to keep the group safe by isolating participants, ensuring social distancing, and routinely testing the players and everyone else in the NBA bubble. There were 0 infections over the course of about 3 months. And while that experiment alone is a little more strict and cannot necessarily be duplicated in the general public, we do see cases where quarantine bubbles can work that aren't as strict as long as there is more routine testing. So according to the August 10th, 2020 article by Michael Paulson at the Chicago Tribune, Godspell in 2020, Mass Partitions and Contactless Crucifixion, Godspell, which is a live play, opened on August 7th as one of 2 union approved live performances. So this is where 12 actors actually live together and sequestered together and still routinely tested for coronavirus while performing nightly. So they performed to about 100 people for 1 month without any positive results. And so by testing frequently, we can kind of make our own versions of these quarantine bubbles and safely spend time with our friends and family, which I believe will definitely boost our collective mental status in being able to see people that we care for and be able to have more interactions with others physically. So again, my proposition is definitely to consider getting tested frequently, ideally every 1 to 2 weeks, regardless of the presence of symptoms. We do all want to return to normalcy during the pandemic safely. And at this time, what that looks like is to verify your current infection status. So that allows us to also build the quarantine bubbles to see the people that we want to see. Again, access to testing is readily available in Los Angeles, and people should be aware of these free resources. And kind of as a closing remark, with a low positivity rate and a continual low positivity rate, we'll even be able to safely reopen our economy beyond our quarantine bubbles. Of course, when we're in public and as we're opening up, we should still operate by standard safety protocols like social distancing and mask wearing, and those should still be emphasized. And I do want to restate that testing does not mean that you are allowed to freely disregard social distancing or any other safety protocols, but that it does help to ensure negativity status so that you can be with the people that you want to be in like an enclosed setting. But other than that, stay safe and well, and please promote and normalize testing COVID-19 frequently. But that's it. Any questions? Yes.
Have you been tested?
Yes. I actually, because I work as a healthcare professional, I also do have to get tested every 1 to 2 weeks. Yeah.
I've gotten tested a couple times, but unfortunately I had to do the nasal one, which is not fun. So
Yeah.
good to know there's oral ones now.
Yeah, there's actually one, there's the oral swab, the FAR nasal swab, and LabCorp actually developed a nasal nostril swab where you just swab your nostril and then they can run the PCR test based off of that.
The first time it stung so bad for 2 hours is the worst.
Yeah, you definitely feel it all. The true, that's the one I do every other, but that's because I work in a clinic and I can just do it there easily. But it's not fun, but it's also doable, But
Yeah,
there are saliva test options out there, and they're even trying to process at-home kits. So hopefully we'll even get more options for testing. Anyone else?
Yeah, I have a question.
Yeah.
So do you think if everyone followed your proposition and got tested every 1 to 2 weeks, do you think we could get out of the quarantine faster?
I think that, I think it would, but I think you also need to consider if people would be able to quarantine properly. Because there are I've seen plenty, and I'm sure you guys have seen as well. There was a video of some young students who had a bunch of people over, and he was like, yeah, I'm quarantining in my house because I have COVID-19. And the policeman was like, you have friends over. That's not what quarantining is. So I think it definitely does have to, testing to see who is positive and who is not is going to help, but people also need to follow the safety protocols. And that's what is going to truly help as well.
Yeah.
Can't have
it would make people more aware when they know that they have coronavirus, but of course there's going to be people that aren't going to follow it still. But I totally agree.
Anyone else?
Do you think it's beneficial to test for COVID, especially when one travels?
I think, it's also you need to consider you can't test immediately after you step off on a flight, because the virus is not going to have enough time to duplicate. So if you test immediately after getting off of a flight where you may have been infected, you're not going to test positive immediately. You have to wait a couple days and then for the virus to duplicate enough for it to be detected. But I do think that testing before, just to ensure your negativity is good, but then also, you know, being wary of, like, dependent on who you are with, that you just, you know, test if you can a few days after, just be aware of any symptoms as well. Thanks for the question.
Okay, I have a question. So has anyone in your workplace or like in your home tested positive for it? And how have you dealt with it, if so?
Actually, one of the people in my, well, I actually kind of 1.5 responses to this question. There was like, it was pretty early on in the pandemic, and I had a patient who, like, I was testing for antibodies. Antibodies came back negative, and then like a week later, we found out that he had tested positive for coronavirus like 3 days after he left our clinic. And then I started getting fever-like symptoms, like that week following. So I was like, oh, I may have been exposed. But then we did the test. I did the nasal swab 2 times following the, like, 2 weeks after exposure. Everything came back negative each time, and we continually did tests. I did like antibody and blood tests as well. All came back negative, so I was like relieved that I wasn't exposed, but I also had like full PPE on, you know? So I at least knew I was protecting myself. But in my other job, we did have a girl who did test positive for coronavirus, but we basically, like, we cleansed the whole clinic. Everyone got tested for COVID routinely the next day, and then the next 2 days, and like for basically the next week and a half, everyone tested. Everyone got negative results each time, and then once the person who was sick had 2 different negative tests within 24 hours, she was able to come back to work. Yeah. So
that you have like a pretty decent procedure. Yeah, it's good to see people actually have a plan despite our
I
government.
think it was also like low key, kind of just like made as things were happening, which I think that a lot of clinics, unfortunately, like kind of have to do, because these are like small private clinics. You know, if you're working at Kaiser, I feel like it's a different route. You'll kind of have a different operating procedure, but at small clinics, it's kind of like, from my experience, a lot of it is like, oh, well, when it happens, we will have protocol then.
I mean, but like, I'm curious about that because it's like, was that the case before or after the pandemic response team was dissolved?
Oh, definitely. I mean, I feel like I think the thing is, I think every business is kind of out on their own at this point. Because there's no way, even like for non-healthcare businesses, like if you work in a restaurant and one of your staff tests positive, you know, they don't have any standard operating procedure of like what to do next.
Because like, yeah, because any indication or what to do was thrown away.
Yeah.
The CDC delivered a report of things to do and it was thrown away. So
yeah,
nice to see people that are organized.
Just gotta routinely test. That's the only option that we have. Yeah, there are options out there. Just I feel like people should know about them. You know, that's the important thing.
Yeah.
That is it. Thank you guys. I'm gonna stop the recording now.